Eleanor.
Well, hi, I'm Eleanor Perfetto, and I'm with the National Health Council, which is a multi-stakeholder group, and the large majority of our membership is patient advocacy groups. And so we have some of the largest patient advocacy groups in the country. A number of them are here today, and we also have some of the smallest groups that represent the rare disease community. When we talk about the patient community, we talk about individual patients, we talk about their families and their family caregivers, the patient advocacy groups, and individual patient advocates. So we think about patient representation as being quite broad. One of the things that happened to us last year when many of the value frameworks were being released was we had a call from our membership and from other patient groups, even outside our membership, because they were struck by how they felt like they had not been involved in the process. And so they reached out and said, what is this? We don't even really know and understand what this completely is, all of these value frameworks that are coming out and that we're reading about in the media. We held a meeting that's one of our regular annual meetings that we have, and it was one of the sessions at the meeting, and we introduced the topic to them. Some of the patient groups expressed their experience at working with or dealing with value frameworks that had come out in their area of interest. And our Q&A session didn't turn out to be a Q&A session. It turned out to be more of a brainstorming session where we said they were saying to the National Health Council, help us. We need to know more about this. We need to be more educated on this topic. We need to know how to be involved and be activated in this area. So we spent the last year at the council working on what we call our value initiative, and it has a couple of different components in it. Dan talked about one of them this morning. In the spring, we put out what we call our rubric, and essentially it was a rubric, a list of questions that patient groups could ask to make an assessment about whether or not a framework is patient-centered and whether or not there's been patient engagement. One of the things that we realized is that even though some of the developers had engaged patients, they really weren't telling us about how they had engaged them. So if you take a look at the dot process that Cliff used, the shaded dot versus an empty dot, I think a year ago, if we had been looking at all of them, we would have said empty dots. And empty dots because patients had not been engaged at all, or empty dots because we just couldn't tell how or if they had been engaged. So I'm happy to say that a year later, I wouldn't say that that's true anymore. I think patients are engaged now. To certain degrees, there's shading. We probably don't have a complete fill on any of those, but we have definitely important movement in the right direction at making sure that there are processes that are known for patients to be engaged. And I think that that's an important change that we have to acknowledge. And that's part of this going from fledgling to being something that's more functional. So when we put out that rubric, and it was a tool for our membership, but it was also a tool for the developers to use to understand what we were looking for and what patient groups are looking for. After that, we also started working on a couple of other things. One is our Get Ready checklist, which came out in August, and that was a document that we put out for our membership so that for those who know that there are frameworks that are being developed in their area of interest on new treatments that they're interested in, they can learn how to get ready, because that was an outcry that we heard from them. We don't know what to do. We're deer in the headlights. How do we get ready to engage? And so we created that Get Ready toolkit for them. We've also had some other things that we've been working on, like qualitative research on how patients interpret and understand the word value, whether it's value in general or value in healthcare. We've also done some work in developing a curriculum for patient groups on how to understand health economics and how to understand value frameworks. And we'll be rolling that curriculum out. So all of these things got us activated in helping our membership and helping them get more involved and engaged in what's going on. So I think in looking to the conversation that we've been having about fledgling to functional, as I said, there are clearly better processes in place that we can find, that we can identify. So the circle is now more shaded. I think one of the things that we have to look for now is when we look at those processes, are they actually processes that patients can act on, have the ability to act on? And we'll work toward making sure that that's more shaded also. And then lastly, as we look to the coming year, when more of the framework reports will be coming out, can we actually see the evidence that patients were engaged from the beginning, that they were involved in that process, that their information that they provided was actively used and incorporated into the process, and so taking it to that next step so that we can be sure that those circles are fully shaded and we've achieved that.
Towards fully filled in circles. staying within the lines, I suppose. Thank you, Eleanor.
We don't have
Michael?
to stay in the lines. We can go outside the
I
lines.
knew she was going to say that. Way outside.